Today's in-service is called Dementia Series, Educational Information for Caregivers in Long-Term Care and Skilled Nursing Settings, presented by me, Adam Beyer, social worker with Behavioral Care Solutions. The first thing caregivers in nursing facilities should be aware of is that there are several different kinds of dementia. I'll list them here. First, there's Alzheimer's dementia, which is the most common. A second is a Lewy body dementia, which results in hallucinations and progressive decline in mental abilities as a result of the Lewy body proteins that develop in the nerve regions involved in thinking, memory, and motor activity. We'll go on to dementia that is commonly associated with other diseases such as Parkinson's disease, Huntington's disease, Pick's, Creutzfeldt-Jacobs, and then alcoholism, also known as Korsakoff syndrome. And finally, there's a vascular dementia. This typically results from a stroke or a cerebrovascular accident, otherwise referred to as a CVA. While the different types of dementia have different manifestations, all of them have some common areas of concern for the affected individuals. These include sleep and appetite disturbances, memory or cognition problems, communication difficulties, mood disruption, and difficulty with hygiene or performing ADLs. So there are multiple events that amplify manifestations of areas in concern for dementia patients, and as caregivers it's critical that we rule these out so as to be able to provide effective care for our dementia patients. Some of these include pain, hunger, fear, boredom, environmental concerns, effects from medications, or the experience of delirium. Here are some facts about delirium. Delirium is an altered state of consciousness with a rapid onset. It may or may not have an obvious trigger. Some of the symptoms of delirium include increased confusion, disorientation, mood swings, psychosis, in other words, hallucinations, paranoia, grandiosity, etc., or distractibility. There's multiple reasons that elderly residents can experience a delirium. Some of these include infection, side effect from medications, metabolic issues, and so on and so forth. It's important to note that delirium is a medical condition. Symptoms should be reported to your nursing staff immediately. Now, in terms of thinking about how to provide effective care to someone with a dementing illness, we should remember basic needs. Everyone has a need to be loved. Everyone has a need to feel useful. And everybody has a need to express themselves. Along those lines, if we keep these three needs in mind, we can attend to them for patients and help them be more comfortable in accepting care and being healthy in the nursing home setting. So let's talk a moment about problem solving and providing effective care with our dementia patients. When difficulties arise in providing dementia care, trying to understand the factors that trigger the difficulties can be a useful method to ensure a successful episode of care. And I've listed on our in-service the big three questions. Is the environment complementing care? Is the patient's medical condition or conditions affecting care? Is there a communication barrier that is affecting their care? Here are some suggestions for improving care through improved communication. Set the tone when you meet with a resident. Think about how you're presenting. Are you tense? Are you angry? Are you frowning? We all have lives outside of work, and facets of our personal lives come to work with us. If we're frustrated by dynamics at home or any of life's many difficulties, it may well show in our behavior and in our affect. And affect is how you're presenting yourself, how your face looks, the emotions that are conveyed through your body language. It's important to remember that people with dementia, as it advances, are less able to express and receive spoken word and instead rely more heavily on nonverbal forms of communication. When I do encounter for psychotherapy, I will do a little mini self-check before even entering a patient's room. I literally will wipe the frown or frustration off of my face. Therefore, my burden is not my patient's burden at that given encounter. This can be particularly helpful for caregivers who may be providing much more intimate care than I ever do. Something for you guys to consider. A second strategy is be non-demanding. Try to use humor and be cheerful. Making a game of something or making a joke of something is much more likely to be successful than ordering a resident or being demanding. Along those lines, being sociable, chatting for a few minutes prior to initiating an episode of care can lower resistance and fear and help resident be more comfortable. Remove distractions. Shut off the TV, ambient noise in the background. All of these things can reduce a patient with dementia's ability to understand what is being asked of them. Orient your resident. Identify yourself. Use the resident's name and explain the task at hand. Make eye contact with your patient. Ensure that you have their attention before speaking to them, and use therapeutic touch as tolerated to convey an empathic meaning. If you see me working in your facility and in having an encounter with a resident, you will frequently see me hunkered down over a wheelchair. You may think, why is that guy doing that? He's going to get a sore back being bent down that long. My strategy is a simple one. If I place myself below my resident's eye contact level, they are going to feel empowered by simple virtue of the fact that they're looking down on me. This is a very, very powerful way to convey respect by getting down to or below someone's actual physical level. Asking simple questions of a confused patient is a huge way to help them be more compliant with care and reduce agitation and frustration. Think about the words you're using. Are they confusing to the resident? Finally, allowing time for information to be absorbed is a critical way for a resident to be more compliant and comfortable with the care that they are going to receive. Here are some things to not do. Don't argue. Never argue with somebody. It only makes things worse. Don't boss a resident around. Don't tell somebody what they can do and can't do. Don't be condescending. Try to refrain from asking too many questions. A confused individual will not be able to answer them anyway. Let's see. Don't talk about people when they can hear you. We all vent, we're all frustrated with challenging residents from time to time, but it's critically important that we don't talk about people where we can hear them. We will lose their respect if we do that. So here are some considerations for environmental barriers to effective care. Is the environment too large? At Schoolcraft, we have a quaint unit that is not large, but some facilities, a large environment, not unlike the regular dining room and activity room, could potentially be a barrier to a confused person. That could help them become more agitated and panicked simply by being in such a large space. And this really comes down to knowing your resident and what can they tolerate. Are they able to accept a large room, a small room? Do either of those trigger behaviors or negative emotions in those individuals? We should try to consider smaller group and dining events. I think that sometimes stimulation is a big trigger to challenges for people who are confused. Sometimes hustle and bustle, shift changes, for example. If we make provisions for these things, it can be very helpful for our residents so far as avoiding having any complications with care and making sure that they have a good day and feel comfortable. I'm a big advocate for a simplified environment. Sometimes clutter is something that's very difficult for residents. Having to navigate that with a wheelchair, the sheer virtue of that is something that can be problematic for a resident. So consider stimulation effects. Is there too much noise? TV in the background, other residents chatter. are those things that can be distressing to a confused individual. And again, it comes down to knowing your resident. On the flip side of that, is it possible that things being too quiet, being understimulating, can be distressing to a person? Some people prefer ambient noise, other people really need peace and quiet. So you'll be able to assess that by reading your patient's own nonverbal behaviors and increasing your insight into what it is that would be helpful as far as helping them be in a good place emotionally. Let's see. Orienting information is very, very important to a confused individual. Dementia patients forget where their rooms are. They forget where the bathrooms are. They forget where the dining room is. When it becomes advanced, they'll forget where they want to eat, what they should eat, or even if they should drink. So it's important that we monitor all of the basic needs and help those residents ensure adequate nutrition, hydration, and overall sense of quality of life despite their confusion. A bit on a sensory environment. As we age, our abilities to hear, see, taste, and smell all change. In fact, in most cases, they diminish. So compensating for this decline in the senses is a huge way to foster a sense of tranquility. I'm an advocate of use of aromatherapy, of ambient noise, perhaps soothing music in the background. Also using diversion-based activities such as therapeutic massage, things of that nature are wonderful ways to help make happy dementia patients. Finally, a word on structure. Many confused individuals become frustrated because they lack a sense of structure in their lives. We are busy as young people and through our adult lives with careers, social responsibilities, being parents, family members, church members, whatever the case may be. All of this seems to go away as we age, and people have a rebound effect, if you will, as they age and become more physically infirm. There's more sitting, there's more idle time. Therefore, activities that are meaningful are extremely, extremely important to dementia patients. Folks, this is all I have for you today. Please look for another in-service series soon. And thank you very much.